Come in.
Okay, good morning, ma'am.
Good morning.
Today, may gagawin po tayo. But before that, I'm going to introduce myself first. I am Judealyn Ismael, a first year student nurse from MCNP. So, before we're going to proceed, may I know your name po?
Mexican to win.
Trixie Katun. Your age po?
19.
Where do you live?
Udal. Bug City, Kalinga.
Okay. Thank you po. Before I'm going to explain to you what we are going to do, I'm going to wash my hand first to avoid the spreading of the microorganisms. So, now we are going to assess your cardiovascular system, ma'am. And can you lay down, ma'am? Okay. So, first, I'm going to inspect the left and right carotid arteries of the patient. Ma'am, pwede ka po bang tumingin doon sa part na yon? Wait lang ha. Ganyan lang. Relax ka lang. Okay. Tumingin ka po dito sa side. Okay, thank you. So, upon inspection, the wave of the pulses in the carotid arteries of the patient are visible. Okay, next, I'm going to palpate the carotid of the patient, and by doing that, I am going to use my index and middle finger to palpate the carotid arteries of the patient. Okay, upon palpation, they are equally elastic, and the rhythm and rate of the carotid arteries of the patient are equal. Okay, next, I'm going to inspect the jugular vein on the patient's neck. Dito po. Okay, upon inspection, I don't see any distension on the jugular vein of the patient's neck. So, it is a normal finding. So, for our next procedure, I am going to assess the precordium of the patient. So, ma'am, is it okay with you if I'll have an access in your chest area?
Yes, it is.
So, I'll be inspecting now po. So, upon inspection, the chests are symmetrical, and then there's no sign of retraction needed, and I don't see any exaggerated hips, so it is normal. Using the palmar surface of my hand, I'll be palpating the precordium gently for pulsations. And by doing that, mauna po tayo sa aortic, then proceed to pulmonic, and then to tricuspid, and lastly sa mitral area. So, okay, I'll be palpating now. So, upon palpation, there is no exaggerated lifts or heaves, so it is normal. So, next, I'm going to auscultate, and first I'm going to use the diaphragm of my stethoscope, and followed by the bell of this stethoscope. So, of course, to listen the low pitch sound. Okay, next we are going to use the bell now of the stethoscope. So, upon auscultation, there's no abnormalities that I heard in the sound. So, it's normal. So, ma'am, pwede ka na pumupo. So far, in my conclusion, lahat po ng mga inassess ko sa cardiovascular system mo po, it is all normal. And I would like to extend my gratitude for your cooperation for today. Before that, I'm going to perform hand hygiene. Okay, ma'am. Have a good day and see you next return.